organizers for inviting me to this fascinating conference. It has been a great learning experience. The topic that has been assigned to me is about financing social protection in developing Asia now and in the future. So the financing issues and the funding issues are going to become key in terms of making advances and meeting the needs for social protection in these countries. The way the presentation is organized is I'll set some context as to why social protection will become increasingly important feature of the both the fiscal space and of the individuals and communities' budgets. Then we'll look at some of the financing options and issues. The main conclusion is that we have got a lot of options that are possible. There is a whole set of menu, and it is not just one or two or three things that will need to be done. But there is no clear-cut combination of those solutions that can be generalized. Each country, and as far as each country is concerned, each particular aspect of social protection, whether it is pension or healthcare or social assistance or labor market. When we talk about emerging Asia, we broadly exclude high-income Asian economies of Japan, South Korea, Singapore, Brunei, Taiwan, and Hong Kong. When we talk about financing social protection, we need to first define what is social protection. Because unless we know what the scope of social protection is, we don't know what the financing needs are going to be. And over the past day and a half, we have heard many different definitions of social protection. Essentially, social assistance and the labor market policies have received a lot of attention. What has not received much attention are the formal social security systems that currently exist, and that would include in primarily pensions, healthcare, and the workman compensation, and the severance pay type of arrangements in different countries. We know that pensions and healthcare are among the largest components of social expenditure in most countries. Though social assistance, and now increasingly when we look at it with respect to the labor market, skill formation and skill development programs are also beginning to occupy a large space in terms of expenditure. Now, what are the factors that are going to make social protection, however defined, increasingly important? The first is obviously the demographic trends. When we look at developing Asia between 2011 and 2030, their share in global population will decline slightly from 45.5 to 43.6, but its proportion in global aged above 60 and above 80 will rise markedly from about 40% to 46% for above 60, and from 29% to 35% for above 80. Now, why it is important to distinguish between above 60 and above 80 is that particularly for healthcare, there is a marked increase in the resources of the society that are used per person as age increases. In Japan, for example, those above 75 take up 4.5 times society's healthcare resources as those who are between 65 and 74. So that aging in terms of the 80 plus is going to be quite important. This implies that more rapid pace of aging will occur in developing Asia than for the world as a whole. And if there is going to be more rapid pace of aging, that also implies that the proportion of the time that we have in order to make adjustment is also going to be relatively small. So there is a degree of urgency in trying to set up particularly the financing and the funding systems. In pension and in healthcare, we know that there is a tyranny of small numbers. Seemingly small number can have disproportionate impact on the financial and economic viability, and there is a long time lag. So once you set it up, it has to be sustainable, like in pension system, for at least 75, 80 years. And if it is not sustainable for 75, 80 years, we don't have that long time span, it becomes difficult to manage that particular pension system. One of the characteristics in developing Asia is that it has got among the three largest populated countries, China, India, Indonesia. And there are other countries like Bangladesh and Pakistan, which also have fairly large populations. And when we talk about in terms of managing the pension, healthcare, and other systems, there are economies of scale in certain areas, but globally we have never seen where, for example, by 2030, as this table shows, in China, there will be 340 million people who will be above 60 years of age. And in India, it will be 188 million by 2030. If we go to 2050, China will go to around 450 million, India 330 million. And we haven't globally had the kind of experience that such large population that need to be managed as to what type of systems, what type of administrative and compliance costs and the record keeping and others arrangements that we will need to make to provide social, even the pensions and the healthcare systems for them. To the labor market issues. And in the labor market issues, the important thing to ask is, what is the total number of livelihoods that the countries will have to generate? And the way we try to calculate the total number of livelihoods is that we take the population between the 15 and 59 or 15 and 64, and between 2010 and 30, how many more are going to come into that age category. And what we find is that the developing Asia between 2010 and 2030 will have to provide about 1/3 of the livelihoods globally. And among them, countries like India, Philippines, and Indonesia will stand out as having to provide large number of livelihoods. China's demographic is such that they actually will have a reduction in that number, minus 10 million, between 2010 and 30. The next table looks at the employment and labor force participation rates in developing Asian countries. So if we think of jobs as an important way in which the livelihoods can be generated or can be maintained, then the employment to population ratio becomes quite important. Fortunately for developing Asia, their employment to population ratio in 2011 was much higher than the global average of 60%. The only standout where it is lower is India at 54%, and this is where India has an opportunity to try to pay greater attention to creation of livelihoods rather than to preserving existing type of jobs that are there. And this is to some extent a challenge in the other countries as well, that how do you create new livelihoods which are going to be sustainable, rather than which depend, given the large number, it cannot be that it could be the workfare programs or the public employment programs. The numbers are too large to make a real dent in the livelihoods through those routes. They can help at the margin, but not overall. The other characteristics of labor market is that the coverage rates in the formal systems are relatively low, and this has been the feature of many developing countries. And the informalization of the labor force is not only high, but it is expected to continue. So earlier what had happened with the OECD and other experiences is that as the formal labor employment began to increase, the employment-based social insurance programs, others automatically got them into the social protection nets. But this is not likely to happen. Even today, 30% of Japan's labor force is in the contractual type of work with not enough pension and healthcare benefits. So now we have to find some other ways in which to extend coverage rather than just the employment-based contributory schemes. Developing Asia has set up a fairly elaborate set of formal social security institutions that will be consistent with ILO's five-fold classification of old age, healthcare, maternity, and so on, except unemployment, which is not there in developing Asia. But the coverage does not mean that the benefits are adequate or that the risk mitigation is adequate. So the developing Asia's challenge will be that not only the coverage will have to be expanded from the current around 25% or so of the labor force to a much larger proportion, but also the risk mitigation and the adequacy of benefits will have to be much higher than before. This table provides the legal and the effective coverage. So now we find that along with the demographics and the labor market dynamics, there are also other factors which are going to increase the social protection need. One is urbanization. We know that already more than half of Asia's population is urban, the share is rising, and urbanization everywhere has meant greater social protection need. Rising living standards. By the way, in ASEAN, as they moved to 2015, ASEAN Economic Community, one of the issues as labor markets freeze up even more for the skilled and unskilled workers, then how to provide social protection for those workers within ASEAN is going to be an important issue, just the way EU has tackled it within their own region. The rising living standards and aspirations and expectations, and the deeper integration within developing Asia and with the rest of the global economy. one of the consequences of globalization, of integration, is the greater degree of volatility in incomes and greater degree of employment and income insecurity. So this is what we are talking about, the shocks where the near poor can move in and out of poverty depending on those shocks, and that is where the social protection needs are going to arise. So now with this particular context, what are our financing options? First, we need to distinguish between funding in an economic sense and financing. Financing refers to the mix of instruments or methods such as social insurance, primarily financed from contributions, budgetary financing, mandatory or voluntary savings, and so on. And those are just the financing part, different types of financing mix that we do. And the financing mix can be divided into public and private sector shares. For pensions, the data collections both nationally and internationally is in terms of public spending, and thus it excludes the private spending. For healthcare, however, there have been attempts to estimate national health expenditure and to delineate public-private shares. But for much of developing Asia, a robust data on the total national health expenditure, but the financing does not mean funding in an economic sense. The funding in an economic sense is based on the premise that the primary source of economic security for both the young and the old is the trend rate of growth of the current level of GDP. Because at a particular time or particular period, it is only that GDP that is essentially available to be shared between the elderly and the non-elderly. So just as we look at the shares going to young and the old, we need to look at the fact that currently many of the formal systems are such that a small proportion of the elderly have already spoken for much of the future resources to finance their pension. But suppose you take that money and then use it for buying government bonds, 100% or 97% as in Sri Lanka, for example, then what happens is it loosens the fiscal discipline of the government with the cheap financing that is available, and that could actually reduce the core rate of growth rather than increase it, and therefore the future savings could actually come down because of the mandatory saving. So all these differentiation and all the dynamics of the way the true funding occurs that needs to be examined when we look at the financing option. As I started out by saying, what options do you use, how do you go about it will depend on what is the social protection package that we are talking about. Now let's just talk about the pension and the health care for the time being and look at what are some of the projections that have been made by the agencies in terms of the fiscal space that will be needed. IMF had a paper in 2011, and what IMF projected in that 2011 is just the public pension expenditure. This excludes the private part of the expenditure. Just the public pension expenditure projections were as follows. The global average will increase from 7% of GDP in 2010 to 8.1% by 2030 and to 9.7% by 2050. So we need about 2.7% fiscal space globally. The corresponding share for advanced countries are 8.4, 9.6, and 11. But for the emerging countries, the respective shares are 5.6, 6.5, and 8.3. Now this may look seemingly small, but if you compare this with tax to GDP ratios of around 12-15%, to get 2-3% more is a huge undertaking in terms of the fiscal reforms and the other political economy reforms that are going to be needed. For some developing Asian countries, the fiscal space needed will be even larger. So what the IMF does is to project that for China, the share will increase from 3.4% in 2010 to 6.7 in 2030 and 9.2 in 2050. So China will need additional space of about 5.8% in that period in order to finance pension, public pension alone. We are not talking about the private sector expenditure on pension. We are not talking about healthcare, not social assistance, not skill formation. All of those are going to cost additional amount. If private expenditure on pensions were added, greater proportion will be involved. Now this is given the low coverage of population, budgetary finance, non-contributory social pensions, resource tested or universal, as we have been discussing, are increasingly advocated. Now what are the fiscal costs of social pensions? And there have been a lot of advocates of the social pensions as one of the important initiatives in order to expand coverage. There is a case for social pensions, but like in every other area, demand and supply will need to be calibrated, and the level and the design of the program will need to be calibrated to the fiscal capacities. And therefore, it is important to know some broad estimates of what the fiscal costs are. Now, here are some of the summaries of the fiscal cost. In New Zealand, fiscal cost in 2009-10 were 4.3% of GDP for their equivalent of social pension, expected to increase to 8% by 2050. So it's not cheap. In Australia, the fiscal cost of means-tested pension were 2.7% in 2009, projected to be 3.9%. So that's another 1.2%. But again, it's not cheap. It's not 1% social protection floor that ILO and others are talking about. It's going to be much, much higher. And even the ILO had estimated that modest social pensions in low and middle income countries would be around 1% of GDP, but its estimates for full social protection package range from 3.7% to 10.6% of GDP. So as I mentioned, even 1 to 1.5% will require substantial fiscal reform. So the idea is not to add on another layer of social protection and expect to be financed by saying fiscal costs are low, but to try to look at it in a comprehensive way as to what other changes will need to come about. Now let me finally turn to the avenues, and right now I'll just list what those avenues are. There are 9 avenues. But let me preface them by saying that like in many other areas, there is no alternative to greater professionalisms in the way we design, implement, finance, and fund social protection systems. So there is scope for economic resource savings through greater professionalism in all the pension, healthcare, and other areas. Now let me give one example. Administrative and compliance costs in many countries are fairly high. In the Philippines, SSS, Social Security System, the administrative cost alone are between 7 to 9% of contributions. In Malaysia, there are 3%. In many countries, the health system is governed by 5, 6 different ministries. We saw the number of social protection programs and so on. So the way the resources that are going, economic resources that are going in the design, implementation of this program, lack of policy coherence, lack of coordination, and we talk about the difficulties in bringing those about, that without moving to professionalism and systemic perspective in those areas, we cannot free up the kind of resources that are needed. The 2004 SJSN law in Indonesia, we know as insufficient clarity on financing benefits and so on, and does not adequately address needs for appropriate organizational incentive structures, generating a lot of fiscal contingent liability and fiscal risk. As a matter of fact, many of the schemes in developing Asia are actuarially generating huge amounts of contingent liabilities and fiscal risk which are not taken into account in the cash accounting based government budgetary systems. Second, enhancing competence to generate resources from unconventional sources such as utilizing state assets, including land, property rights, such as airspace, oil and mining resources, more completely, more competently, and more productively. So the reforms are not, or the resources are not going to come from increasing just the contribution rates. Many countries, contribution rates are already too high. China, it is 40%. In India, it is 36%. Malaysia, it is 27%. In Vietnam, it is 30%. Some countries like Indonesia, it is low, they can increase it, but many countries are not going to be able to increase the contribution rates. So unconventional sources which have often been neglected, partly again because of the accounting, cash accounting does not provide balance sheets, so there is no asset registry and there is no proper utilization of airspace and other assets that are needed. Exploring better coordination among and between pension and healthcare sectors for resource savings and for greater policy coherence. Sixth, financial innovations, particularly in the payout phase. Because when you look at the individual and what are the risks that they face in old age, one is longevity. We all know we are going to die one day. We don't know where, when, and how. And so we want the resources to last until death, and that longevity risk needs to be addressed. There's an inflation risk. A pension amount or an annuity amount in nominal terms at time of retirement asymptotically declines by rate of inflation if it is not indexed. And there is a survivor's benefits because of the women's lower labor force participation. They need protection towards the end. So what is the financial innovation? How do we reduce delivery of services? The World Economic Forum, I'm a member of that team, is trying to, there's a meeting next week in London of the World Economic Forum to try to address some of these issues on what the financial industry can do to provide innovations to try to reduce transaction cost. So transaction cost reduction in service delivery, better risk sharing between insurance companies, the individual, and the government will be needed. We know that in developing Asia, the individuals and households will need to bear a greater proportion of increased share devoted to old age financing. So what do they need? They need a secure and stable policy and regulatory environment for long-term savings by the individuals, including tax arrangements and so on. With increased longevity, healthcare costs will acquire greater significance. So the promoting healthier products and habits should be part of public policies designed to reduce the need for health expenditure in old age. So idea is not just to finance whatever is needed, but idea is to reduce the expenditure. And that is that if we can have better healthcare, better schooling, better other public services in many areas, that would free up the household expenditure, which is now going towards addressing the inadequacy or low quality of those services by purchasing private healthcare or private education and so on, or water supply or electricity. And that is, so idea of the better delivery of public services and the broader governance and fiscal reforms will have to be part of the way of freeing resources. So now the financing funding is how do we free up the resources through greater efficiency rather than how do we just get the money per se. Let me just make a couple of final concluding remarks. One of the points that is usually mentioned is that, oh, the fiscal space is there because the conventional tax to GDP ratios are low. But those conventional tax to GDP ratios are understated. I had one of my students go to Jakarta, to Bangalore in India, and to one of the other cities in Asia. And their different students, their task was to follow informal sector workers for 3 days and note down how much of their income or receipts which they get has to be turned over compulsorily to the agent of the state, but that money does not go to the treasury, doesn't show up as tax to GDP ratio, but to an individual who is paying that amount, it is a tax. Because tax is an involuntary transfer from the non-government sector to the government agents. And these are government agents to whom these low-income people have to pay. So the idea that the tax burden is low is not really quite true, particularly for many low-income and other people. Now, I have not discussed the political economy and political management challenges, but there have been success stories in doing that, and we need to do more research as to how do we think of funding, financing in a more comprehensive way than what we have been used to, which is increased contribution rate, reduced benefits, or do other things. Thank you very much.